Shereen Bhutta Center of Excellence. I'm very, very happy that this has been done in her name. And I think that is what we should be doing, honoring all our people who have served humanity. And this is the greatest service that to humanity that can be done, that we set up a center of excellence here for research and for the well-being of women and children. So having said that, let me tell you that I know many of you sitting here, and I've worked with many of you sitting here, and we have health and what Dr. Bhutta said. Yes, women leaders bring a lot to the table. They are the ones who lead from the front, who always think about the woman and child. They are mothers themselves. They are nurturing spirits, and therefore they bring to this situation the best of best that they can do. And I think Shaheed Mohtarama Benazir Bhutto Sahiba did a lot for women in that. She brought in the Lady Health Workers Program. She even brought in women police officers, so that, and the first women bank for women to access loans, etc. So, and then our government came in, the federation led by President Nasir Zardari Saab. We gave the BISP program, Benazir Income Support Program. So a great deal has been done, and obviously he was also led by his wife's vision. As Professor Bhutta said, he's been led by Shereen's vision. So really speaking, Asif was also led by his wife's vision, and therefore he brought in this BISP program for women. And I think currently the need obviously is that we, when I was working in a civil hospital, मैं जब civil hospital में काम कर रही थी, वहाँ labor room was a butcher's shop. Really speaking, OTs were a butcher's shop. Where gynae obstetric units में, it was unbelievable the amount of stench that there was, the unhygienic conditions that were there, and the fact that women were treated without any respect, without giving them love and the dignity that they deserved while having their children. So things have to change, and they have changed to a certain extent, even in the public sector. And I think this message has to go out that women are, when they are in labor, I mean, it's a labor of love though, and it is a labor that they have to go through because obviously they are the procreators, and the procreation is something that is divine, and therefore unki jo hai, unki health or unki safety should be our priority, and that's what this center will bring forward, I think. और हमारी जो है काविश रहेगी कि हम हमेशा जो है health department in government will be in full support of this sector. So Nighat, kudos to you for setting this up. मैं तो बहुत impressed हुई हूँ कि हमने इस तरह की जो है young doctors produce किए हैं. All these young doctors standing here, they are dedicated, and beyond doubt they will be giving great service to this community. और मुझे ये पता है कि हमने community midwives का, that is the second cadre, lady health workers के बाद we needed community midwives. I remember USAID ने एक program शुरू किया था, USAID has set up this building also. USAID ने एक program शुरू किया था where they had given stipends and training to 1,500 midwives, community midwives को उसके लिए funding दी थी to the government of Sindh. Well, 1,500 community midwives are lost in the households. I don't know where they went away, because मैंने जब health ministry take over की, तो मुझे नजर नहीं आ रही थी वो community midwives in the community serving the people. So I started thinking about it, and then we put in a service structure for community midwives, which was not present in the health department. तो हमने health में community midwives का service structure establish कर लिया है, और उसके ज़रिए we wanted to put in community midwives in all our basic units, our government dispensaries, where institutional deliveries could occur in a better environment with hygiene and sepsis taken care of, and the child care should be there as well. So ये हम program स्टार्ट ही करने वाले हैं, और 10 इसके पायलट प्रोजेक्ट्स शुरू हो चुके हैं थरपारकर में, and we've done those 10 units. And those 10 units are serving well in the community, but unfortunately floods happened. So that puts a step back. You know, when we take one step forward and we have to push back one step back because हमारे पास catastrophe after catastrophe हो रही है. So really speaking, by hopefully next year, beginning next year, GDs will be starting to function. We'll start functioning 93 GDs in the remotest of areas, and where service availability is not present. Dr. Bhutta spoke about equity of health services. Yes, I understand the need for equitable health services, and the remotest, the underserved areas, the poorest of areas need our services. And I think this center, with its research, will enable us, and also training, as Dr. Bhutta emphasized, we need human resources, yes, and definitely human resources of a high caliber. Human resources that are not FCPSs or degrees, postgraduate degree passed, but who have the skills to deliver services. And I know, Shahid sitting there, they are doing Institute Kuigot. We have already given them money to train community midwives because they were in a center of excellence, and we realized that, and we put in some 25 community midwives from the remotest areas are coming to that center to be trained as community midwives. So बहुत सारी चीजें करने की ज़रूरत है, and I would also like to emphasize here the need for post-pregnancy family planning. We need to give the space to the woman to recover her health post-pregnancy, so that इसमें भी, you know, I know Nighat is very passionate about it. Satya Jafri is very passionate about it. हमने obstetricians और gynecologists को भी involve किया है कि they should be taking